As we age, our bodies undergo many changes that can affect everything from our energy levels to physical abilities. However, one area often overlooked is how these changes impact intimate health, particularly when it comes to masturbation. For people over 65, the effects of this common activity can have more significant consequences than they might realize. While masturbation is a natural and normal part of life, its impact on circulation and overall heart health may not always be fully understood. Over time, these subtle changes could silently affect your well-being without you noticing, particularly as blood flow and circulation become more delicate with age. It's important to be mindful of how activities like masturbation can influence your intimate health, as it's not just about pleasure, but also about maintaining a healthy circulation system. If you've been wondering how your body's handling such things, it's worth taking a closer look at your habits and making sure your intimate health is in check. If this topic interests you, don't forget to like this video, subscribe to our channel for more helpful tips, and leave a comment to share your thoughts or ask any questions you might have. We'd love to hear from you. Imagine a situation where everything seems fine on the surface. You're leading your life, maybe feeling a little slower or more tired than before, but that's just a part of getting older, right? You might have heard of the usual advice about eating right, staying active, and seeing your doctor regularly. But when it comes to something as private and personal as masturbation, most people overlook it, especially when they're in their later years. There's an assumption that if you're still capable of doing it, it's perfectly fine to keep on, just like you always have. But this belief could be doing more harm than good, especially when it comes to your circulation and intimacy. Think about the way your body reacts during sexual arousal and orgasm. For a lot of people, this process is a way to relieve stress or even boost their mood. However, as you get older, your cardiovascular system doesn't work the same way it used to. The efficiency of your heart, the flexibility of your blood vessels, and the overall strength of your circulation all decline. So while it might feel like the same experience you've always had, the strain on your body is different now. If you're not aware of how your body is changing, you might find yourself pushing too hard, unknowingly straining your heart or your arteries. Masturbation can raise your heart rate, spike your blood pressure, and increase circulation, all of which can cause more damage than you'd expect if your body isn't conditioned for it. When you overdo it, you might start to feel lightheaded, or maybe you notice that your energy drains more quickly after, but you might not connect those dots. This is the first danger, not knowing your limits and pushing yourself past them. And then there's the matter of lubrication. As you age, the skin becomes thinner and less elastic, especially in areas that are frequently involved in sexual activity. The friction from masturbating, if done without proper lubrication, can cause damage to the skin. In your younger years, you may not have had to think about lubrication, but as your skin becomes more fragile, it's essential. Without it, you could be causing microtears in the skin, which leads to inflammation and discomfort. Over time, this damages the sensitive tissues and weakens circulation in those areas. The lack of lubrication isn't just uncomfortable, it's a direct link to reducing the quality of your sexual experience. But most people don't talk about this, so they continue to use outdated habits without realizing they're risking their intimate health. Let's consider another aspect: posture and positioning. Most people never think about the physical position they're in while engaging in masturbation. However, as you get older, the way you sit or lie down during these activities can affect circulation. Some positions might put pressure on blood vessels, restrict airflow, or even compress vital organs, causing numbness or tingling sensations. The positions that were comfortable for you in your youth can now have adverse effects on your body, especially if you're sitting in a way that restricts blood flow or causes your legs to fall asleep. These seemingly small changes can build up over time, making the act less pleasurable and more physically taxing. And yet, because they're minor, you might not even realize how much they're impacting you. It doesn't end with just the physical habits. As you age, your emotional and psychological well-being plays a huge role in your overall health, and this is no different when it comes to intimacy. Masturbation can be a deeply personal and emotional experience, and as you age, loneliness and isolation often become a part of life. For many older adults, feelings of depression or anxiety creep in, affecting their desire or ability to enjoy intimacy. Without the right mental and emotional state, the experience can become more of a chore than a source of pleasure. Stress, loneliness, and anxiety can all tighten your muscles, increase your blood pressure, and worsen circulation. The link between your mental state and physical health is undeniable, yet it's often ignored when discussing intimacy and sexual health in older adults. If your emotional health is intended to, these factors could sabotage both your circulation and your overall ability to enjoy intimacy. Perhaps even more overlooked is the reliance on external aids to aid sexual pleasure. It's natural for people to look for stimulation, whether it's from fantasy or some form of visual or physical aid. For many over 65, external aids become increasingly relied upon to achieve sexual satisfaction. While this isn't necessarily harmful in moderation, it can actually hinder your body's natural ability to respond to intimacy. What happens when you're too reliant on these aids is that your body begins to lose touch with its own internal arousal responses, weakening the natural circulation mechanisms that should be triggered during sexual activity. This reliance can create a psychological barrier where the experience feels disconnected from the physical sensations, leading to less satisfying experiences and further damaging intimacy over time. The final issue that most people don't think about is overall health. As we grow older, cardiovascular health is something that everyone should be paying attention to. Poor circulation, high blood pressure, and even conditions like diabetes or heart disease are more common in older adults, and these can directly affect how your body responds to sexual activity. When your blood circulation is compromised due to these health issues, the risk of experiencing problems during masturbation or intimacy increases. Engaging in such activities without taking care of your overall health can exacerbate these conditions, making it harder for your body to bounce back after a session. People often ignore their cardiovascular health, thinking it's separate from their sexual function, but they're more connected than you realize. You may be wondering, after reading all this, what can you do to improve the situation? First, listen to your body. If something doesn't feel right, if you experience pain, discomfort, or dizziness, don't ignore it. Take a step back and reassess your habits. Understand that you're not the same person you were at 20 or 30. Your body has changed, and with those changes comes the need to adapt. Use lubrication, take your time, and avoid pushing your body too hard. Pay attention to your emotional state and seek help if you're feeling isolated or depressed. Your mental health is just as important as your physical health when it comes to intimacy. And most importantly, check in with your overall health. Regular checkups, especially when it comes to cardiovascular health, can make all the difference. If you have any concerns, don't hesitate to talk to a doctor. Your sexual health, your circulation, and your overall well-being all deserve attention. By making small adjustments, you can enjoy a fulfilling and safe experience, both physically and emotionally. Aging doesn't mean you have to give up intimacy, but it does mean you have to be more mindful. Don't let habits go unchecked. Instead, be proactive in taking care of your health so that you can continue to experience pleasure, connection, and joy for years to come. As we grow older, intimacy doesn't have to fade away. It can evolve, adapt, and continue to bring satisfaction as long as we take the right steps to care for our bodies, our hearts, and our minds. As we get older, our bodies change, and that includes how we experience intimacy. What might have felt easy or normal in your younger years can now have a bigger impact on your heart, circulation, and energy levels. Masturbation might seem harmless, but without paying attention to your body's limits, you could be putting strain on your system without even realizing it. Small things like using proper lubrication, choosing better positions, and being in the right emotional state can make a big difference. Your skin becomes more sensitive, your circulation slows, and even your mental well-being plays a major role in how you experience pleasure. It's all connected, and the more aware you are, the better choices you can make for your health and comfort. You don't have to stop enjoying intimacy, you just have to adapt. Listen to your body, be gentle with yourself, and take care of your overall health. With just a few thoughtful changes, you can keep intimacy a meaningful and joyful part of your life, no matter your age.